everyone, welcome to Cascade Psychology. So from this video I'm going to talk about developmental psychology, and also this video will lead to many other few videos as well, because I'll be talking about subtopics that come under developmental psychology. So let's get started. First we'll see what is developmental psychology. We can define developmental psychology as a scientific study of age-related changes through the human lifespan, also how people grow and change over the course of a time. So it is also a discipline of scientific inquiry. Developmental psychology recognizes humans of all societies and cultures as beings who are in process of constantly growing and changing. So beginning with Sigmund Freud and Jean Piaget, the early focus of developmental psychology was on child development or the maturation of children. So when we are talking about human development, there's a big question which comes up, which means they question whether human development is nature or it is nurture. So the people who say that human development is nature, they emphasize on the influence of individual heredity, universal maturation process guided by genes, biological based predispositions, and biological influences. On the other hand, people who say human development is nurture, they emphasize changes in response to environment, all the external physical and social conditions and events that can affect us. So mainly they emphasize on learning. So now let's see the 8 periods of the lifespan. First we have prenatal stage, which means conception to birth, and infancy and toddlerhood, birth to 3 years, early childhood 3 to 6 years, middle childhood 6 to 12 years, adolescence 12 to 20 years, young adulthood 20 to 40 years, middle age 40 to 65 years, and then late adulthood 65 years and above. So we are going to look at physical, cognitive, and psychosocial development of each lifespan. So physical development includes growth of the body and brain, sensory capacities, motor skills and health. Cognitive development includes learning, attention, memory, language, thinking, reasoning and creativity. And psychosocial development includes emotions, personality and social relationships. So first we'll look at the prenatal development, which means conception to birth. We can divide the physical development during the prenatal stage into 3 stages. First one is germinal stage, and then embryonic stage, and then fetal period. Germinal stage is between fertilization to 2 weeks. Fertilization or conception means the process by which the sperm and ovum combine to create a zygote. So before implantation, the zygote begins to differentiate into 3 layers: ectoderm, endoderm, and mesoderm. Endoderm means the inner layer, ectoderm means the outer layer, and mesoderm is the middle layer. So placenta connected to embryo. Placenta is connected to the embryo by umbilical cord. So nutrition passes through umbilical cord from mother to the baby. Then when talking about embryonic stage, which means 2 to 8 weeks, organs and major body systems develop rapidly, and this is a very critical period because the possibility of happening a miscarriage is high. Also, smoking, drinking, alcohol and drug use increase the risk of miscarriage. Then we have the fetal period, 8 weeks to birth. So during this time, the fetus can breathe, kick, and turn. Male fetuses are more active than female fetuses. Also, during this time, the baby develops taste cells and also respond to sound. So, during the prenatal stage, basic body structure and organs are formed. Physical growth is more rapid of the lifespan. Also, vulnerability to environmental influences is great. So now let's see the cognitive development during the prenatal stage. So environmental influences such as medical drugs, alcohol, nicotine, caffeine, marijuana and cocaine can cause effect to the fetus. So alcohol is not safe to drink in any amount during pregnancy. Alcohol use of during pregnancy has been found to be the leading preventable cause of mental retardation in children in the United States. Also, children with fetal alcohol spectrum disorder cognitively have poor judgment, poor impulse control, higher rates of attention deficit hyperactive disorder, and also learning issues and low IQ scores. So these developmental problems and delays persist into adulthood. Next, we are going to talk about the second stage, infancy and toddlerhood. First, we'll talk about the physical development. So, newborn is dependent but competent, and the children grow faster during first 3 years, and their head is proportionally bigger, and teeth start around 3 months, and full set of baby teeth by 3 years. Also, all the senses are active at birth. So, early sensory capacities include touch and pain, smell and taste, hearing and sight. Also, physical growth and development of motor skills are rapid, such as rolling over, grasping rattle, jumping in a place, and coping cycle. So next we are going to talk about the cognitive development. To describe cognitive development in each stage, I'm going to use Jean Piaget's theory of cognitive development. So to describe cognitive development in infancy and toddlerhood, we can use first stage of the theory, sensory motor stage. So object permanence is visible during this stage. For example, object permanence means if a child is playing with a ball and when he moves, if we hide the ball, the child still can remember that there was a ball and the child will look for the ball. So that's what we call object permanence. Also, speech development or language development is very rapid during this stage. We can see there are different stages in this language development. First, we can see pre-linguistic speech, then early vocalization, gestures, first word, and then first sentence. Also, self-awareness develops in second year, and also all senses operate at birth, so ability to learn and remember is present. Then we are going to talk about the psychosocial development. So to describe psychosocial development in each stage, I'm going to use Erik Erikson's theory of psychosocial development. So to describe psychosocial development in infancy and toddlerhood, we can use two stages of this theory. First one is trust versus mistrust, which means This stage is centers around the infant's basic needs being met by the parents. So failure to develop trust will result in fear, and success in this stage will lead to the virtue of hope. For example, we say the child is crying, and if the mama knows, okay, the child is crying because the child is hungry, and if mama feeds, then the child knows, okay, when I'm crying, mama is there. So there's a trust building between the child and the mama. But if the child cries, if mama doesn't approach the child, then the child thinks, okay, when I cry, mama doesn't care. So which means mistrust is built. And the next stage is autonomy versus shame and doubt, which means in this stage the child begins to explore his surroundings and to do for himself. Key challenge relates to exerting independence. For example, maybe tying the shoelace or buttoning himself. So those include success in this stage will lead to the virtue of will. And then moving on with the third stage, early childhood, which means 3 to 6 years. So first we look at the physical development. So at this stage, development of fine motor skills. Fine motor skills means the coordination of small muscles in movement, and also gross motor skills improve, which means abilities usually acquired during childhood as a part of a child's motor learning. Also, we can see independence, self-control, and self-care increases. Then the cognitive development during this stage, we can use Piaget's second stage, pre-operational stage. So at this time, the child can use language. Also, the child uses symbolic play. For example, if the child wants to play the role of a doctor, the child may take a teddy bear as the patient and he'll act as the doctor. So that's what we call symbolic play. But at this stage, the child can't take perspective of other person or grasp principles of conversation. Also, the child can't arrange objects along a dimension. On the other hand, play, creativity and imagination become more elaborate at this stage. Then we have psychosocial development. We can use Erickson's third stage, initiative versus guilt. So, child tries to master the world around them, learning basic skills and principles of skills. And the child develops conscience. So, when trying to master the world, maybe some behaviors make them feel less, so which means there's a guilt within the child. Moving on, we have middle childhood, 6 to 12 years. We'll talk about the physical development. So the main importance of this stage is puberty. In girls, menstruation begins. Also, we can see several physical changes such as breast develop, hips widen, and pubic hair. In boys, production of sperm begins. Physical changes can be seen such as facial and chest hair, and voice deepens. And then cognitive development, we can use Piaget's third stage, concrete operational stage. So at this stage, they develop principle of conversation, also egocentrism, and also logical reasoning. Then we have psychosocial development, Erickson's fourth stage, industry versus inferiority. So the developmental task at this stage is to achieve success. If failed in this attempt, the child feels a sense of inadequacy. Moving on, adolescence, 12 to 20 years. Physical development. So physical changes are rapid and profound. Also, reproductive maturity is attained by this time. So physical development starts earlier for girls more than boys. Also, body assumes an adult-like appearance. And then cognitive development. We can use Piaget's fourth stage, formal operational stage. So at this stage, moral abstract, idealistic, and logical thinking and reasoning will develop at this stage. Psychosocial development, we can use Erikson's fifth stage, identity versus role confusion. So success in this stage will lead to the virtue of fidelity, which means faithfulness to a person. Moving on, young adulthood, 20 to 40 years. So by this stage, physical development they complete the process of physical maturation, and cognitive development, they move into adult roles and responsibilities, and they fully understand abstract concepts, and they identify career goals. And then psychosocial development. So the developmental task is to form good relationships. So success will lead to committed and secure relationships. And if they fail, they suffer emotional isolation, loneliness, and depression. Moving on, middle age, 40 to 65 years. Physical development. We can see some deterioration of physical health. Also, stamina takes place. So at this time, wrinkles form, organs no longer function as they once did. Also, lung and heart capacities decrease. Also, decrease in strength, coordination, reaction time, sensation, and fine motor skills. Cognitive development. So men are faced with the realization that they are no longer 20 years old and that they are not going to accomplish all they wanted in life. And men and women may sometimes suffer from diminished self-esteem. Also, we can see wisdom and practical problem solving skills are high at this stage. For some, career success and earning power peaks. For others, burnout occurs. Also, at this stage, their search for meaning in life assumes central importance. Also, time orientation changes to time left to live. Also, for a minority, there is a midlife crisis. And then psychosocial development, we can use Erikson's seventh stage, generativity versus stagnation. So in this stage, one goes beyond self and family and wants to help the next generation. So characteristics of generativity includes creativity, productivity, and commitment. So failure in this stage leads to unproductive and uninvolved in the world. Moving on, late adulthood, 65 years and above. Physical development. Actually, health and physical activities decline somewhat, and slowing of reaction time affects many aspects of functioning. Skin continues to lose elasticity, reaction time slows further, muscle strength diminished, hearing and vision decline significantly, and also immune system is weakened. Cognitive development. So intelligence and memory deteriorate somewhat, although there are some who are mentally very alert. Also, there's a need to cope with losses in many areas, and also need arises to find purpose in life to face impending death. Psychosocial development, we can use Erickson's 8-stage ego integrity versus despair. So this is the core crisis at this stage. If one has lived a productive and worthwhile life and has coped with his failures and success and has fewer regrets, then he has achieved ego integrity. Otherwise, one feels despair, hopelessness, resentment, and self-disgust. So that's it for this video. Thanks for watching. If you need any help regarding notes and more facts, please do contact me via cascade.psychology@gmail.com. Watch my next video, the part 2 of developmental psychology, where I'll be talking about theories of development. Thank you.